Now we are going to talk about a specialized field, which is wildlife veterinary medicine. As we all know that it's a specialized field where the wildlife vets involves themselves in multiple species, starting from mammals to amphibians, birds, reptiles. So this is a kind of diversified field, and we need to understand multiple areas so that the holistic approach of wildlife veterinary medicine will happen. The first one is the diverse species knowledge. As I mentioned, we need to deal with variety of species, and we need to know each and every species behavior and their natural way of approaching the inter and intra-species relationship, and their anatomy and the behavior and the diseases. So these three major areas like diseases, anatomy and behavior varies between species to species and from the larger to a smaller scale of animals. So it is important to understand the diverse species knowledge. And the second important point is the field-based challenges. As we all know, the variety of terrain where the wildlife vets works is definitely from a desert to a thick rainforest, or even sometimes close to the human habitat where the fringe of the forest or even the protected areas like sanctuaries and national parks ends. So those are all the different terrains we always have to use, starting from your high temperature to a low temperature variance and high altitude areas. So we always have to have sufficient field-based challenges, and overcoming that challenges is part of the wildlife veterinary medicine. The third point is the conservation and ecosystem health. As we all know that we deal with One Health concept in the recent era. One is the ecosystem health and animal health and the human health. So when we deal with wildlife veterinary medicine, it is always in a multidisciplinary way of approaching the diseases, because we know that there are a lot of zoonotic diseases emerging. Having said that, we know about this COVID-19, how much it has created, the pandemic created the issues within the humankind as well as the animals. So it is important for a wildlife veterinarian to understand the wildlife veterinary medicine has to be approached in a multidisciplinary way, and then interdisciplinary activities and sharing and collecting data are at most important. The fourth point in wildlife veterinary medicine is wildlife disease surveillance. So each and every vet has to understand the disease dynamics and surveying of all these diseases which are very common, and the infectious and zoonotic disease comes under that, and we all know that there are multiple zoonotic diseases are present in the environment, and we need to understand their disease dynamics and the relationship between the pathogen, host and the environment. So based on that, it will be easier for us to understand and ensure that better preventive cares are in place so that there won't be any calamities or even transformation of diseases from animals to human beings. And monitoring and controlling of the disease is also important with respect to the surveillance of the disease. The second important point is the human-wildlife conflict mitigation. When we deal with wildlife veterinary medicine, conflict comes under the same picture, and we need to understand if there is any conflict, then there is a high amount of interaction between the people and the animal, and there is always a possibility of transmission of pathogen or even contracting the disease from one species to another species, and it needs to be addressed, and we need to understand the ecosystem health so that again the same One Health concept is achieved. The other collaborative approach concept in the same wildlife veterinary medicine is very important, and as we already talked about the veterinarian skills, not only about the technical side and also the people management side will also enhance to collaborative approach between different disciplinary activities. As I mentioned already, wildlife conservation is not only with wildlife biologists or vets or conservationists, it includes biologists and ethologists and sociologists and behavioral experts and even in interdisciplinary activities like human police department and also fire brigadier. So it is always involves multiple disciplinary approach, and everybody's inputs definitely makes major changes, and it will be remarkable when we deal with a collaborative approach and then achieve the conservation in a better way. Another important point in wildlife veterinary medicine is ethical and legal considerations. And as we already discussed, the wildlife veterinarian should always, in compliance with the legalities of the Wildlife Protection Act, has to be definitely taken into consideration and ensure that the permissions, whether it is a regional, national or international level, has to be achieved appropriately so that no legal consequences will happen. And at the same time, even if it is international, something like CITES, wherever it involves, then it is mandatory for the wildlife veterinarian to address the issue and then ensure the appropriate authorities' permissions are gathered before we deal with such kind of interventions with respect to wildlife veterinary medicine. The other important point is the public education and awareness. Many vets, even I can mention some of those vets purely involved in their public interaction or social awareness programs and creating a lot of education materials, and also makes a lot of brochures and even posters for the society or even for the community wherever the wildlife human interface are always happening, and then they involve themselves to create a lot of education materials, or even conservation educationists or educated with the help of wildlife veterinarians and biologists always leads to a better success in wildlife veterinary medicine. The last but not the least point is research and development. As we already discussed, research is an integral component of wildlife veterinary medicine. As we are keep growing with our technologies, and also even the current practices of artificial intelligence are also used in some kind of evolving technologies, even with the drones or even immobilizing the animal from the remote distance are always possible, and a lot of thermal cameras are being used for wildlife conservation areas. And there are multiple examples. You can always go into Google and search a lot of information about it. So the research and the development of scientific areas, whether it is a disease diagnosis or to the treatment or even dealing with conflict situations, always plays a major role in the component of wildlife veterinary medicine. Wildlife vets always face a lot of challenges when it comes to wildlife health and disease management. I just wanted to give one simple example what we faced in the rehabilitation of sloth bears, and when it comes to their infection with tuberculosis. And as we all know that the captive animal facilities always have the preliminary or primary problem of tuberculosis, and which is a very important zoonotic importance, and it's a kind of notifiable disease if it comes to human beings. Here in the rehabilitation center of any even ungulates or even other animals, we primarily face this tuberculosis problem. As I said, it is primarily a zoonotic important disease and also affects the respiratory system. So it is always a pulmonary tuberculosis. In our case, in this dancing bear rescued from this Madaris population, like from gypsies or even from the Kalandar community, they were always contracted the disease from the human, and when we start losing the bears when they were severely infected with pulmonary tuberculosis and they were not able to breathe properly, and then they lose their life, it has become very big challenge for us to even diagnosis, and apart from the diagnosis, the treatment itself is a big challenging stuff. I'll just explain you a few things, like when it comes to the Mycobacterium. Commonly we face Mycobacterium bovis and Mycobacterium tuberculosis complex, and generally we expect Mycobacterium bovis in animals and the Mycobacterium tuberculosis in humankind. When we say this is a zoonotic disease, here we found this has become a reverse zoonosis, and these animals lost their life because of tuberculosis, were always AFB, I mean acid for staining bacilli positive. But with this AFB staining, it is not possible to rule out the individual species, or spolichotyping is the only way that we can get into the species level identification. When we always think about the staining methods, it gives only a major picture of the genus, which is Mycobacteria. So we have dealt these problems with a lot of in detail biotechnological or even serological diagnosis, and we came up with a test kit called lateral flow test kit, and which is really one of the milestone for us, and we were able to identify it. But the diagnosis was very simple through a lateral flow test kit, which is a tabletop test. When it comes to the diagnosis, it is difficult because they will not show any kind of pathognomonic symptoms like sneezing or coughing or discharge from the nostril or even eyes. So it is challenging. So when we keep the animal on the table after immobilization, we always rely on this tracheal wash or lung wash. We have to put an endotracheal tube and pass a tube, and then put normal saline, and then gather the normal saline back into a sterile container for culture and sensitivity, and also culture examination. When we talk about this, the past history of the animal is always important, and isolation is also very important in general quarantine procedure. But when it comes to this Mycobacterium, we were finding very difficult when the animal was isolated. They get into stress and the TB proliferates further. So the other important aspect here is when the diagnosis itself is challenging, but when it comes to treatment from the vet's perspective, very difficult to feed the animal with anti-TB drugs. As we know that we have primary tuberculosis drugs, anti-tuberculosis drug, and secondary anti-tuberculosis drug. Though we have an injectable anti-tuberculosis drug called streptomycin, which is very much difficult to give on a daily basis in a large animal population. So that is when we always go for a oral anti-TB medication. Oral anti-TB medications, as we all know, that isoniazid, rifampicin, pyrazinamide and ethambutol. This combination is always effective. And the other important point here is, if it is not dealt with a proper primary anti-TB drugs, it always leads to MDR, multi-drug resistant TB, or XDR, extremely drug resistant TB, which is very, very potential cause or potential possibilities to transfer the disease from the animal to human beings. So here we screen all the staffs once in 3 months, starting from your skin test to chest x-rays and also ultrasonography and the blood profile. The same thing we also follow with the animals, especially in bears. All the skin tests were very non-specific. We are not able to identify anything. So we get into multimodal diagnostic models like X-ray. Every third month, every bear's chest X-ray will be done to see is there any pulmonary complications. And the blood profile, though it won't give you a clear-cut image about the TB infection, but still we will be seeing a marginal changes and ensure the animal is not into any other infection or even immune compromised, so that they will not get this problem or the TB will not get aggravated. And the other thing is ultrasonography. As usual, the endotracheal tube with the lung wash or even the sputum sample is another ideal way of diagnosing them. When it comes to this other managemental aspects, as we always know, and we feel important that in any captive animal facilities, it is important to keep an eye on their body weight and body condition score, because as we all know that the tuberculosis is a chronic wasting disease. When you find any differences in their regular body weight, or the drastic down in their body weight, or even if it is an increasing body weight in a decreasing fashion, then always we should suspect for these chronic wasting diseases. So husbandry practices are very, very important to find out whether the disease is improving or the disease is contained within that population so that it will not spread. And we have never seen any kind of spread between animals because it was in an unnatural host. As we said, the animal TBs are always Mycobacterium bovis, but here we have made a culture and diagnosed confirmatively that this is Mycobacterium tuberculosis complex, which is very common in human beings. So this Managemental practices includes the feeding. So the regular daily feeding monitoring by a vet is very, very important, so that we can ensure that the animal is having good appetite and eating properly, and they are in positive energy nourishment or positive energy balance. So only then it is easier to contain the disease. And the other point I just wanted to mention here is, in this tuberculosis in animals, we never find any latent TB, whereas in human being it is always common that this latent TB itself is a kind of non-clinical or even unsymptomatic tuberculosis, which is very, very difficult to find, and in our opinion it is not even occurring in this captive animal population called this latent TB. So it is always an infective stage, and we have to be very careful. And we now start using this anti-TB primary drugs as a prophylactic way, after even consulting a human pulmonologist, and it is really effective, and it is definitely containing the disease, and we are not losing any animal until or unless they have other comorbid issues or even geriatric cases or elderly bear. I mean, when they are close to their lifespan of 25 to 30, it's always possible to have another comorbidity issues like even liver failures and renal issues, and that leads to proliferation of this tuberculosis organism or mycobacterium organism in their body, and it leads to mortality. And post-mortem samples and collection of evidences for all these possible post-mortem samples are really important, and keeping all the records and documentation is very important for us to transfer the knowledge to a younger generation or a next generation vets. So this is one example. You can imagine how much challenges every wildlife veterinarian is facing while they are dealing with wildlife health and disease management in different aspects, because we are covering the vast amount of species and vast amount of behavior, vast amount of body size, vast amount of their geographical location and the climate or the weather or the environment where they are living. It all gives us different varieties of challenges in front of a wildlife veterinarian, and one should have adequate experience and knowledge to deal with all kind of challenges. And I really feel that this example will give you a better understanding of how the wildlife veterinarians are facing challenges when it comes to the wildlife health and management. When the mortality of the bear happens because of pulmonary tuberculosis, the grass lesions looks very, very, very clear, and you can see the rib impression on the lung parenchyma, which makes the diagnosis or grass lesion very clear, and you can always suspect for tuberculosis. That is because of the edematous lung. In this picture you can again see a lot of calcified nodules and filled with pus, and the normal parenchyma of the lung itself has disappeared. The bagging of this lung filled with litters of pus, a lot of purulent discharge, and generally when it slided or cut open, you can see the caseous material. It's kind of insipitated pus, and you can see the cutting itself will be, while you are putting the BP blade into the lung parenchyma, it looks very hard, and it comes. Here you can see again the entire lung portion in a thoracic cavity was as such viewed, so that you can easily understand the collapsible lung parenchyma will not be there. It is a kind of hard structure and then filled with pus and even this liquid inside the pulmonary area. It leads to pulmonary edema, and then a lot of fluid filled in the thoracic cavity, and this the entire fluid will be of easily diagnostic importance or value. And you can see the lung parenchyma is completely gone. There is no normal alveoli or even space in the lung parenchyma to do gas exchange or for the normal respiratory pattern. So it is very challenging to understand or even to expect the animal to show some kind of pathognomonic symptoms. As I already mentioned, the entire lung is filled with a lot of cavities, and then the cavitations, or even sometimes even the miliary tuberculosis is also very common in these captive species when it comes to rehabilitation. Here again you can see a lot of incipitous pus and then filled with a lot of calcified masses, and when it cut open, it gives a lot of grains and then hard object, which is obviously a chronic calcification because of tuberculosis. Wild animal nutrition is a big topic and a vast content, but wildlife veterinarian should always keep an eye on the scheduling and making a feeding schedule for any animals in the captivity.
Wild animal nutrition is crucial for health, growth, reproduction and survival, both in captivity and in the wild. Let us see some basics about wildlife nutrition. The first and foremost aspect is species-specific diet. Wild animals have evolved to eat diets specific to their natural habitat, from herbivore and carnivore to omnivore and specialized feeders. Understanding these diets is essential, as improper nutrition can lead to health problems and impact overall survival. The second wildlife nutritional component is macronutrients. As we all know, macronutrients are proteins, fats and carbohydrates, and protein needed for growth, tissue repair and reproduction. Carnivores often obtain protein from prey animal, while herbivores rely on plant-based sources. The fat provide energy and are necessary for cell function, hormone production and insulation. Many animals accumulate fat to survive periods of scarcity. The third macronutrient is carbohydrate, mainly sourced from plant. Carbohydrates supply quick energy. However, some carnivores require minimal carb. They rely more on protein and fat for energy. The third important aspect is micronutrients. As we all know, vitamins and minerals are the major micronutrients, and vitamins are essential for immune function, metabolism and development. For instance, vitamin A is crucial for vision, while vitamin E supports immunity, and biotin is for fur and hair growth, etc. And when it comes to minerals, they require for bone structure, nerve function and cellular processes. And for example, calcium and phosphorus are important for bone, while trace minerals like zinc and selenium supports various metabolic functions. The fourth important aspect is their energy requirement. When we talk about wildlife nutrition, the energy needs vary by species, age, activity level and environmental conditions. Juveniles, a pregnant animal or lactating females, and hibernating animals and animals in colder climate often require higher caloric intake. The other important aspect is their foraging behavior and enrichment. The enrichment also involved in compensating some of the nutritional components. Like in captivity, it is essential to replicate the natural foraging behavior of wild animals to ensure mental and physical health and well-being. Providing environmental enrichment can help mimic hunting, grazing, or even browsing activities. The other aspect is their digestive physiology, like ruminants and monogastric animals and hindgut fermenters. So for example, ruminant animals like deer and antelope have specialized stomachs, and as we all know that they are four-compartmental stomach to digest fibrous plant material through microbial fermentation. Whereas the monogastrics like carnivores and omnivores such as big cats and bears have simple stomachs suited for diet high in protein and fat. When it comes to hindgut fermenters, as we know that like elephants and horses digest fiber through fermentation in their large intestine. And say for example, elephants, they generally have a poor digestibility, and because of that they eat a lot of food like 250 to 300 kilos or sometimes even 500 kilos a day. That is just because of their poor digestibility. So before making a feeding schedule for captive elephant, then we should have all these basic criteria before we make a diet chart for any captive animals. The next important aspect is the natural seasonal diet variations. Wild animals adjust their diet based on seasonal availability. For instance, bears consume high-calorie food before hibernation, while herbivores may rely on nutrient-dense foliage in their growing season and more fibrous plants in their dry season. The other aspect is even the hydration needs of these wild animals. As we know, water is essential for digestion, thermoregulation, and cellular functions. The source and amount of water required vary by species and their habitat. And the other nutritional aspect is their deficiencies and excesses. So imbalances in nutrition can lead to deficiencies like vitamin E deficiency causing muscle degeneration, or sometimes even excesses such as too much fat causing obesity. Both can affect an animal's health and lifespan. The other point is the feeding in rehabilitation and captivity. In captive settings, wildlife nutrition requires careful planning to balance the right type and quantity of food and mimic the wild diet as closely as possible. So this includes offering natural prey for carnivore or high fiber vegetation for herbivores. So the last component of this wildlife nutrition is the human impact on their wild diets. As we know, habitat destruction and changes in food availability can alter natural feeding patterns, sometimes forcing animals to adapt to human provided foods, which may be nutritionally unsuitable or lead to human-wildlife conflict. So, in a nutshell, this proper wild animal nutrition is fundamental to their health, welfare and conservation, particularly in captivity and rescue settings, where diet must closely replicate what animals would consume in the wild.
And it is crucial for their health, reproduction and survival, and also the disease prevention and management. So the wildlife health management is directly proportional to the nutritional requirements of the animal. And within this wild animal nutrition, it varies between captive and the free-ranging wild animals. And let us focus on the captive animal nutrition with respect to different species. And the common topics we should understand about this wild animal nutrition is every individual species have got their species-specific way of evolving, and their natural habitat is always the deciding factor for their nutrient and nutritional content. And as we all know that the macronutrients are protein, carbohydrate and fat, and the micronutrients are like vitamins and minerals, and multiple micro and macro minerals and vitamins are there, like fat soluble and water soluble. And the other important aspect of this wild animal nutrition is their energy requirement. So we all know that the animals, when they are in different need, like whether they are in breeding condition or lactating or pregnant, so they varies with their nutritional requirement. So the energy requirement depends on their activity, and even for hibernation or before hibernation and post hibernation, their requirements will vary. Foraging behavior and environment is again a part of an integral component in the wildlife nutrition, because it is difficult to replicate the natural vegetation in the captive conditions, and it is always depends on the availability and the economical situation or the funding possibilities of the captive facility to provide the food resources to the captive animals. And the digestive physiology is also a major deciding factor when we are trying to fulfill the nutrient requirements of the wild animal. Some of them are ruminants with multiple stomachs, so some of them are carnivores or omnivores, so their physiological function with respect to the digestion is totally different, and some of them are specialized digesters or even hindgut fermenters like hogs or even elephants. Their physiological requirements are different from the other animals. and natural seasonal diet variation. So some of the natural diet variation, when it comes to a free-ranging area, the animal prefers some kind of high energy diet. For example, even bears, just before hibernation, they take a high amount of energy diet so that they can store it, and then during the hibernation they can definitely utilize the stored energy for their dormant lifestyle. And when it comes to the hydration status, even the water acts as a very important nutrients in managing the wildlife nutrition. And when we are formulating the diet, it should definitely be included with ad libitum amount of water, potable water in any captive facility. And nutritional deficiencies and excesses, as we always know that if it is a deficiency of any vitamins and minerals, it again gives a bad impact on the health. And if it is excess nutrition, definitely obesity kind of problems will also occur. So at times of rehabilitation centers, sometimes we have to give a live prey so that the animal should go back to the wild with no intervention with people, or even different kinds of food will make them very incapable in the wild when they were released back into the natural habitat. Human impact again plays a major role, because sometimes the harvesting their natural food resources from the free-ranging area deprive of them for food, and sometimes that leads to conflict situations. So some of these salient points are mentioned now, and there was a good attempt by ICAR with the guidance of our current DDG ICAR, Dr. Ravindra Bhatta. With his guidance, this was published in the year 2024 by ICAR about nutritional requirements of captive wild animals. So it was a big honor for me to work along with Dr. Asit Das, and he's a principal scientist and IVRI Delhi. And it was actually with basic information about wild animal nutrient requirements, and this is a nice attempt, and probably those who are really interested in wildlife nutrition, we can definitely create a wonderful resource material for wild animals depending on the species requirement. Then that will definitely be useful for the field and the captive wild animal veterinarians to formulate a healthy diet for all the wild animals in the captive facility.